Let me invite Mr. Rupak Barua for his special address. A big round of applause for him, please.
So, thank you so much for giving me an opportunity to share my experience actually. I'm not a tech person, but I'm a very simple hospital administrator. And what are the issues we are facing actually in terms of implementation of the digital initiative that I would like to share a little bit, and how this your digital progress is happening in the healthcare space. See, you all know that healthcare is a prime concern now, and everybody is talking about healthcare because it's growing in very fast. One of the fastest growing industry is now healthcare. Particularly, more we are talking about healthcare post-COVID situation. We could understand during this year, COVID, what kind of catastrophe happened. And we are quite aware of the situation, and we are quite sensible on that. And we have started taking care of our health, our well-being, our families over the time. Now, in the process, if we talk about that's digital health or digital healthcare, actually, it's not a very single approach. It's a multidisciplinary approach. It intersects actually technology and healthcare. That's the whole we are talking about digital healthcare. Now, over the time, it applies to digital healthcare, applies to this and incorporates your software, hardware, and the services, healthcare services. Now, if we see this during this post-COVID-19 time, we could see that's the breathtaking space that digital healthcare actually has expanded. It expanded in many ways. If we quantify this expansion of this digital healthcare, that in 2018, in INR this total healthcare digital expense was around 118 billion, and in 2024 we are expecting that it will be reaching to 495 billion. It's almost is a CAGR, computed annual growth rate over the 5 years in terms of your growth of this digital healthcare in in India. I'm talking about it is almost 27%. It's a huge growth that we could see, and more maybe in the coming days. The way this healthcare disruption is happening, more it is going to take place. Now, why digital healthcare is coming more? That is one part. Is a digital innovation is happening, digital technology disruption is happening in terms of your healthcare. And one part also the affordability and accessibility. You see, simple statistics that in India, if we are considering that the healthcare infrastructure, 73% of the healthcare infrastructure actually based in the urban area, and 23% of the healthcare infrastructure in the tier 1, tier 2 places in the rural areas. Where in the opposite, if we see, the 70% of the population actually stays in rural area, less than 30% population actually in the urban area. But the 30% population of the urban area actually enjoying 73% of the infrastructure, and the 70%, those who are the most of the time, we see that's the more than 50% of the population actually doesn't have the access to your minimum health care. That's the situation today. So just to mitigate the situation, actually, that is the only way that we can see as a healthcare policy, that the digital healthcare can reach out to the individual, more digital part. And also we can see that the digital healthcare is reducing the cost as well. That one of the major important aspect of this your healthcare, the shortage of manpower, shortage of human resources in terms of doctors, nurses. So creating only infrastructure in rural areas is not going to help us until and unless we have sufficient supply of manpower for delivering this your quality healthcare. So that's why this your digital interpretation is happening. More of the innovation is happening. If you see, there is a startups, actually the huge number of startups working in this digital space. Now, post-COVID situation, we all are in the healthcare where we are working. We have taken an oath that digital is the only way that we can take it forward, that healthcare we can take the forward. Now, all the processes and systems all are digital right now. We have all introduced different kind of apps. You are using this your digital apps. We have introduced this your electronic medical records. All our healthcare processes, the clinical process actually is digitized. So we have introduced EMR as well, that is the electronic medical records. So this way, and each and every process is actually just to give hassle-free experience of the patient. The processes actually has become this your digitized. That's the whole part. Now, in other way, if you see, the security and the cyber, what we are discussing today, that has not been taken place. The way this your growth has taken place in terms of your expansion of the digital initiative, but the security part, if we are talking about cyber security or the digital security, has not yet been taken place. See, in healthcare, we do not have much budget in terms of your IT solutions. So we try to manage in a very restricted way. But as of today, after this incident started happening, the whole healthcare sector actually is discussing right now what is the way forward. How we'll be able to handle, we'll be able to tackle this situation the way it is coming up. Now, particularly if you see this in the 2021, we can see that 7.7% of the total, that cyber crime happened, it is in the healthcare. And the last, I think, talking about this, what happened is in the All India Institute AIMS, that is a fiber server actually got hacked. In Calcutta also, it has happened in one of the hospitals, that is all the radiology data being hacked. Now, healthcare, this data actually, this big data is very important because these are all patients' data. And as I had mentioned, there's a whole processes and system is through this your digitized only. If there's some kind of a disruption happened in this in the process, whole chain of our clinical treatment part will get affected. If there is no radiology reports available, the whole treatment process will go. And then the hospital that happened, they could not accept or they could not reach out to their data almost for next 5 days. That's a tremendous kind of a situation. So yes, of course, there is a lot of, we are also working, we are also discussing with a lot of external people how we can take it out. We have started taking a lot of measures as well. There is one part also we have started now talking about because it is a very niche area, but this is we have the digital governance part also that is in the process. All the systems, all our access part also that we have restricted each and every employee's access part also that we have employed. So we have started working on it, but it's a huge concern. It's not at all. We understand that what exactly is the susceptible part, whether the people, the process, or the organization. As of today, we are really not even been identified, but we can see this year whatever is happening. If I can talk about our healthcare aspect, there is 80% is the human error, 20% is the technology. So if this 80%, if we can take care, we'll be able to handle a lot. You see, in our hospital also, what happened this year, all the this year process, as I had mentioned, the doctor's appointment and all, it's through all your online system. All you are using this kind of an app of any of the hospitals, all the doctor's appointment, doctor scheduling, even the payment gateway, all is through this app only, because nobody has got time to reach out to the hospital. Particularly the senior citizens and all, they are also using this because they have also little bit becoming tech savvy. They have started using this app. But now how the people are working, this app actually, whenever anybody is trying to reach out to this or any hospital's website, there is a pop-up is coming up. They say, yes, you are looking for this doctor's appointment. So we are, of course, I am going to give you the appointment of AMRI doctor only. I am sending a link. Please register and give 5 rupees. There is a transaction so that we can activate you this thing. Immediately he is getting a link, accept link, because they are quite innocent people. They are looking for a doctor's appointment. Sometimes some of the big doctor's appointment is very difficult to get. So he's saying, no problem, I'll be giving you next tomorrow only. And I think that's the person actually had lost 1.45 lakhs in 10 minutes time. So this kind of situation is happening in healthcare. There is many of the major incidences happening in healthcare. So though we have started a lot of awareness and all, but the most easiest and simplest method, I think this is the awareness. We'll have to reach out to the people. As I was discussing with Mr. Sanjay Das as well. So he has agreed that he will come out with a plan how he can reach out to all our staff, all our doctors, our patients online, through Zoom, that more and more of awareness if we can create, so that we can stop to some extent at least this kind of a cybercrime in the healthcare sector. Thank you so much.
Thank you so much, Mr. Rupak Barua, CEO and Group CEO and Director of AMRI Hospitals. So when I started this conference today, I said that the main aim of building this company was APAC News Network, where we bring communities together for knowledge sharing. And I can see since morning there have been many aspects of knowledge sharing and breaking the silos and partnerships happening between the 2 state governments, even the hospital chain sitting in Kolkata and the state government IT department, and now a very important sessions with the enterprise CXOs of Kolkata. So thank you, Mr. Barua, and thank you, Mr. Vinit Kumar, for joining us today for this session.